Okay. So my name is Luke Kopish. I'm the Deputy Director of the Alliance Center for Independence. And we are here with the Somerset County Board of Health. And this is an effort at the Alliance Center for Independence to let people know in Somerset County about vaccines, where to get the vaccines, the status of the distribution of vaccines, and hopefully any any answers or questions that people may have about the vaccines, and really where we are in the pandemic. ACI received a grant from the Disability Vaccine Access Opportunity Center, which really is the purpose of the grant really is to reach out to people with disabilities, people with their families, people who are, you know, maybe don't have access to information, maybe people who are consider themselves marginalized. And the purpose is really to reach out to those individuals who may or may not have access to information. So this is an opportunity to talk to the Board of Health in Somerset County about getting access to vaccines. So hopefully this will be helpful for a lot of people out there. Okay, and thanks again, Amanda, for this.
Absolutely. Thank you.
Okay. So the first question is, again, can you say your name and your title, please?
Sure. My name is Amanda Amodio, and I am the Public Health Preparedness Coordinator for Somerset County.
Okay, great. So what does it kind of expect as far as COVID-19 now that it's winter? Is there going to be an upsurge of COVID vaccine or COVID in the county, or what do you think?
So right now we have seen an uptick in COVID-19 cases, as well as other respiratory illnesses. The community transmission level is calculated differently this year than it was last year. So comparing the two may be a little tough, but we are prepared for any uptick in cases.
How is the county being prepared? What was the county doing to prepare itself?
So we actually have a whole team dedicated to the COVID-19 response. So we work collaboratively with the New Jersey Department of Health, all of our public and private agencies, and all of those partnerships are really important for us to adequately respond. Additionally, with the approval of the county commissioners, we have implemented a mobile vaccine unit. So that unit actually helps us to increase vaccine access to those who may not be able to come to our static clinic. So our static clinic is something that we've had for 2 years at the Somerset County Senior Wellness Center in Bridgewater. It's a known place, and people can easily come there. It's a beautiful facility. So we're there every other week, but the mobile clinics will actually open that access up to people who can't come there during either that day of the week or those hours. So the mobile clinic has vaccination availability throughout the community in places such as churches, the YMCA, senior living facilities. And then our staff also continues to work with the schools to ensure all of our school-age children and their family have access to vaccines if they want it. In addition to that, we actually have COVID-19 rapid antigen test kits that we are distributing throughout the county in collaboration with our community partners, other local health departments, and some of our targeted outreach events. So, we're able to scale up vaccination or distribution of these test kits, but we also have a team that monitors and tracks COVID-19 and respiratory illness trends. And based on that, we're ready and willing to scale up as needed.
Great. Now, can someone find out where the mobile vaccine clinics are located, or what by week, or where they are?
Yeah, absolutely. So the Somerset County website is updated with the most recent clinics that we have coming up. Also, it has the clinics that some of the local health departments have available too. So you can go to the county website, which is www.co.somerset.nj.us. And I can email you all of that information if you want to post it anywhere for some of your listeners. But yeah, so there's a section on the county website where the health department has a page, and it has all of our information. So it's up to date with all of our clinics. That includes the Bridgewater Clinic, it includes the mobile clinics, and also it has information for people to find or schedule a homebound vaccine. So our mobile unit can actually go out to someone's home and vaccinate them there if they are homebound or, are unable to come to any of our other clinics.
Okay, awesome. Okay, terrific. So what vaccines are available? What Pfizer? What is available through the county?
So in Bridgewater, we have Pfizer and Moderna. So that's going to be all of the approved vaccines for Pfizer and Moderna, ages 6 months and older. We do have the Janssen vaccine, which is just the monovalent primary vaccine. So if someone hasn't received their primary dose and would like to receive the Janssen product, we have that. Our mobile clinics have all of that, and they also have the Novavax vaccine, which is a primary vaccine series for individuals ages 12 and older if they opted not to have Pfizer or Moderna.
Now, if someone's getting the vaccine for the first time, or or getting the booster, I mean, is there a waiting period? I mean, I hopefully not so much anymore, but is there a waiting period in Somerset County?
So no, you can get your vaccine at our clinics. If this is your first time, we have the vaccine there for you. So you don't have to wait and schedule or put your name on a list or anything like that. We are happy to help you right there. The immunization schedule is a little different. So between your first and second dose, there is a bit of a waiting period, but not because of vaccine availability. We have an adequate supply and are more than happy to help anybody.
Well, do you have any idea, like, what percentage of adults have gotten all 4 shots or have gotten totally vaccinated with boosters? Is it, is there still work that needs to be done to outreach people who may not have done this?
Yeah, so there's always going to be work that needs to be done. So right now, the CDC changed its recommendation. So all individuals 18 and older are eligible for a bivalent booster product. So right now, for anyone who is eligible for that product, we're at 20% coverage. So right now, the county's here just to ensure that everyone has access to that product if they want it. So we're doing that through our, like I said, the mobile clinics, Bridgewater, we always have that, and then homebound. So, we just want to make sure we have that option available in as many places as possible and as frequently as possible, so people can come when it's convenient for them.
Now, I assume because we're a disability organization, we have to ask about accessibility. Have there been any accessibility issues with the fixed clinics as well as the mobile clinics for vaccinations?
So accessibility, our nurses are amazing. I have to just say they are willing to help out in any way. And the Bridgewater, the Somerset County Senior Wellness Center at Bridgewater, I mean, it is an accessible facility. So they have, ramps, and the doors, automatic doors. The hallways are wide, which are really great. So people can, move about pretty easily. And then again, with homebound, if there is, someone who just cannot come to a clinic, they can be vaccinated in the comfort of their own home.
Okay, perfect. I'm glad you mentioned about the homebound because, a lot of some of the counties that other counties we work with, there was a waiting list, at least in the beginning. How long a wait does someone expect to have between calling up and saying, I need a vaccine, I'm homebound, to actually getting it?
So it is not a long wait. Our mobile unit goes out weekly and vaccinates. So depending on if they have gone out for, that week, they may have to wait for the next week, but there's not like a long queue where they have to wait weeks or even months before they can be vaccinated.
And someone can go on your website to register or to make an appointment for a homebound visit for the vaccine.
Yeah, absolutely. And that process is a little bit easier than you would think. So you can actually call up, you could text a number and you can make an appointment. So you don't even have to sit online and fill out a form or anything for a homebound vaccine. You can actually talk to someone live. We type
Okay.
that information in, and then our clinical staff will reach out and just schedule you. So we make it super easy.
Do you need any proof that you require homebound visit, or, proof of disability or proof of illness that prevents you from going out and getting the vaccine?
There aren't any like specific criteria that someone has to meet. A lot of people, who are homebound, they just call and they, or a family member will call and schedule that for them. We just want to make that as easy and accessible as possible. And we don't want to ask too many questions and limit anyone for any reason.
Okay. Can you just address like people under 18 and the percentage of people under 18 who have gotten vaccines? Do you see that as high as adults or not so much?
So the infant vaccines for children ages 6 months to 5 years, they were recently approved in the summer. So we had our first clinic at the end of June, and we had weekly clinics for infants only throughout the summer at the Somerset County VOTEC. So those vaccines haven't been out as long as the adult vaccines, but I do have some numbers for you for the primary series of the vaccine based on age. So those data are broken down into different age groups. So we have the 6 months to 2 year age group, and this is for primary series. So we're at 5% coverage. 3 to 4 year olds, that's 10% coverage. 5 to 11-year-olds, and that vaccine's been out a little bit longer than some of the younger kiddos, and so that's at 49%. And then those who are a bit older, 12 to 17 years old, we're at 70% coverage for their primary series. So yeah.
That seems to be about the average across the country, 70% for the age bracket, or?
I don't have the country data. I can pull up the state data and get you, some of that information.
Yes.
There's a lot of it. So based on, what you're looking for, but Somerset County is a pretty vaccinated county. We do have a lot of people who come out to our clinics. Again, having that static clinic at Bridgewater, it's well known, but also just increasing that access in communities, partnering with schools. Those clinics have been amazing. So So yeah, we're getting out there, and anybody who wants to be vaccinated can. And we've been doing this on a weekly basis for 2 years now. So yeah.
Okay, good. So I you basically answered all the questions I have. There's one last question. I mean, I guess can you repeat the website to get information about getting vaccines to the county?
Yeah, absolutely. So the Somerset County website is www.co.somerset.nj.us. There's a page specifically dedicated to the health department, and once you click through that, and I could send you the exact link. So you can look on that page and see all of the services that the health department offers, and all of our other county agencies as well. I can give you the homebound number, because that's probably going to be a really important one for people to know if they want to call or text to schedule a homebound appointment. So that's an 800 number, and that is 1-844-569-0390. And then, of course, they can always call us directly at the health department, and I will be happy to provide our number. If anyone has any questions about the vaccine and just needs to talk to someone, we have a team of health educators and nurses who are more than happy to help. So that number is 908-231-7155. And that is going to get you directly to the Somerset County Department of Health. That's where I sit, our health educators, our nurses, our epidemiologists, we all sit here. So that's our number, and feel free to call. We're happy to help.
Okay. Amanda, I appreciate your time and all the information you provided. This has been a good conversation. I appreciate your help in helping us understand the services provided by the county. Okay.
Awesome.
Thank you
Thank
very
you
much.
so much for your time. Thanks for having me. I appreciate it.
Okay. You're welcome.
All right.
Okay.
Take
Have a
care.
great rest of your
Bye.
day. Bye.